Victoria's in Nottingham. Victoria, what would you like to say?
Hi, I am a psychiatrist in Nottinghamshire, and I've just been listening to what you've been saying, and I think one important thing to be really clear about is that junior doctors want training places. They don't want international medical graduates to not have jobs or not be given training. It's just that they want to be able to have training places. Yeah. And I do agree with you that this is the government's way of painting the issue of no training places as, inverted commas, those foreigners' fault. And I don't like the use of the word foreigners.
Nor do I.
No, I prefer to say international medical graduates. That's what. That's the better term. So going forward, I think you have to look at this not just as a snapshot either, as, you know, more of a longer journey from years back, in the sense that staffing the NHS and adequately planning for a medical workforce has been inadequately done for many, many years. And therefore, people, instead of using strategic decisions, they've made very quick decisions about trying to fill rota gaps of medics. And therefore, what they've done is they've opened up schemes to try and bring international medical graduates to fill those gaps. And consequently, what they've done is they've offered them the most rubbish of the medical jobs that involve no training, no support, literally just filling these service gaps. You might be familiar with the term locally employed doctor. Yeah. Basically, what that means is that a trust can employ a doctor under whatever salary they like, give them no training and support outside fulfilling clinical duties, and therefore they do just plug that gap. So they've employed lots and lots of international medical graduates who really are some of the ones that are more willing to fill these gaps because they want to come to the UK. They've heard how good the training schemes are. And then the international medical graduates have aspirations, as many doctors do. Yes. You know, being a doctor is a career. And they've heard that the British training system is very, very good, so they've applied for that. So actually this problem has been created by the government itself, and now it's been painted as the fault of international medical graduates.
That might be my fault. That might be the way I've presented it today, because the current government would have no problem at all, and indeed West Streeting has gone all in on blaming it on previous governments. This is prior to 2020. The mess that you're describing, inherited by the current government, who are now seeking to undo it, albeit, in your view, I sense, imperfectly.
See, I would disagree on that
point. Which bit?
I think it's much, much easier for a government to say, look, let's prioritise our UK medical graduates and not correct the problem that we created ourselves many years ago. You know, you need to own that problem.
No, but I'm just pointing out it's a completely different government.
Yeah, but they're perpetuating those kind of racist views, aren't they?
I don't know. I mean, it's interesting to hear you say that, because I don't currently, and I've understood most of what you've said, and I'm certainly going to take on board what you said about international medical graduates, or graduates with British citizenships, or people who've worked in the NHS for a significant period will also get priority for training posts under this bill, as I'm sure you know, but I should probably be explained sooner. Just in something about the relationship between training, country, and job doesn't stick in my craw in the way that I expected it would, to simply say we're going to try to fill these posts with people who trained here, with people who graduated here first, before we cast our net a little bit wider. This is another thing as well about the training system in the UK, and it's a very, very old traditional system where, as your previous caller mentioned before, she's a foundation year doctor and she feels as if she's jumping through hoops. And do these things actually add up to better patient care? And who actually sets the bar? Who actually sets the height of these hoops for us to jump through? Are you letting the perfect be the enemy of the good? Or the perfect be the enemy of the better?
I don't think it's perfect. I think...
That's what I mean. I think you're pursuing perfection and therefore perhaps not valuing improvements to what is currently going on because they don't go far enough.
I think improvements to what's going on at the moment would be to recognise those doctors who aren't in training at the moment, of which there are many, many. What we do know is that the GMC's workforce report says that locally employed doctors and SAS doctors, who are doctors not in a training scheme and not a consultant, make an increasing proportion of doctors, and those doctors' experience needs to be recognised outside of training schemes. And basically, it means that training schemes aren't really fit for purpose.
Yeah, okay, but no one yet is really talking about rewiring or dismantling and rebuilding the entire system.
Actually. There is a medical training review.
Well, then you preempted my final question, which is why are the BMA agitating for what you don't think is a good thing?
I think,
or campaigning, not agitating.
You can't really say BMA. What you're looking at is you're looking at the Residents Doctors Committee within the BMA.
Well, no, the strike mandate for 59 days since 2023 comes from the membership, not from the committee.
It does, but the resident doctor membership. So nobody was asked about this that wasn't a resident doctor. So this is purely the resident doctor.
But this is what they want
and needs. Yes. And what they're wanting is they're wanting more training places, aren't they?
Yes, and also they're wanting international medical graduates to be the second port of call rather than the first equal.
I think...
So why are they doing that, is what I'm asking you. You may not know. I mean, I'm curious.
I think it's frustration with the training scheme and the fact that there's no training spaces. I think you need to thoroughly understand the workforce, the medical workforce and the training scheme and the initiatives for that to be able to...
Okay.